WHT Local Lifestyles continues.
The Vanderburgh County Health Department is on a mission to make local families safe and healthy with their new Pre to 3 program. Lynn Hurt, no stranger to lifestyles, is the Director of Clinical and Outreach Services for the Vanderburgh County Health Department. And she is here with Nurse Terry Cooper, personal birth consultant and certified car safety instructor, person from St. Vincent. So welcome.
Welcome.
Thank you. And so glad to have you both on the show. We've been enjoying the Pre to 3 program and learning all the many phases of it. And of course, child safety is number one.
Yes, and one of the reasons child safety is because accidents are still one of the number one causes of infant mortality in that birth to the first year of life. We have a lot of issues and a lot of checklists and those kind of things to make sure that our babies are sleeping the way they should be sleeping.
We talked about last time.
Yeah,
yes.
So we don't have any deaths from unsafe sleep practices. And same with motor vehicle crashes. We've had a death last year in our community from a motor vehicle crash, and that's why car seat safety is so important and part of those checklists that we go through in our Pre to 3 program.
Well, Terry, let's talk about that. I know as a grandmother, right, we had our baby then at St. Mary's and now St. Vincent's, and boy, that was the one thing. You don't leave that hospital until that car seat is in place.
Exactly, and we do a lot of education with our new parents and any caregiver that comes by. I check car seats, probably about 50 or 60 car seats a month. It's important to know what car seat you need to be using, the direction that the car seat needs to be facing. You know, if you want it rear facing for a child under 2, that's the safest thing you can do. You want to know where in the car is the safest place, so we always educate them on that. And then you want to select the harness height and the installation.
Well, let's talk a little bit about, because we see all of these systems, some that go from the sick car to the stroller to the grocery cart. What is the safest system? Because we're moving those seats a lot. Okay,
you want a seat that's going to fit the child and that the caregiver is going to use correctly. That's the most important part of choosing a car seat. Rear facing for a child under 2 years of age and at least 30 pounds is what we educate. And then they need to go into a car seat that has a harness. These car seats nowadays have a harness up to 65 pounds. That should be a kindergartner or first grade. So no child should really be in a booster seat until they're kindergarten, first grade.
And that's just important information to know. Now let's talk about taking those seats out and putting them back in, because at the hospital you're going to get us in there right.
Right.
And we're going to drive away, but we may remove it.
Correct. So really, when they come to us for a car seat check, we teach the caregiver how to install it. We don't install it. We'll get in the car with them, show them the safest way to install the car seat. But our goal is to make sure the caregiver can take it out and reinstall it if they need to.
And it's kind of, you know, it can be a big deal.
Yes.
You need to know how to do that. So, Lynn, how did you and Terry partner up for this safety program?
Actually, we work together on the Vanderburgh County Safe Kids. And so we've been working together for years on this. But then we also sit 2 of our community health workers that are out in the home seeing families on a regular basis through one of Terry's car seat education classes. So now they're car seat technicians and can be able to do that right there in the home. Just following up with families to make sure that they're really understanding their seat, they're installing it, and if there's ever issues and someone can't come up with funds for a seat, we do have a grant that helps with that. And so we wanted to make sure that car seat safety is kind of a no-brainer for the Pre to 3 program.
Well, that's one of the many things that you do in that program, and we're going to continue to follow all the work that they do. Thank you, Terry. Thank you, Lynn.
Welcome.
It's always great to have you.
Thank you.
We'll be back with more local lifestyles right after this. Stay with us.
This portion of Lifestyles is sponsored by the Vanderburgh County Health Department.